For the last 100 years, surgery has evolved at a rapid pace, and since the millennium, that pace has continued in even more significant ways. With the adoption of laparoscopic surgery in the 1990s, patients are demanding less invasive procedures that reduce recovery time and complications and allow them to return to their normal routine as quickly as possible. Because of this, Lumendi is dedicated to developing medical devices for the advanced endoscopist that reduce the need for surgery and enhance endoscopic interventions that lead to faster recoveries, better outcomes, and lower costs. After several years of development, Lumendi has successfully merged the principles of laparoscopic surgery, instrument triangulation, tissue retraction, and dissection with the benefits of flexible endoscopy. This new evolution in patient care is called DiLumen C2. The Lumendi DiLumen C2 is an endoscope accessory consisting of a dynamic dual balloon system that creates a therapeutic zone to enhance visualization, diagnosis, and endoscopic treatment. In addition, it incorporates two 6mm working channels at the 3 and 9 o'clock positions. These channels accommodate the DiLumen IG grasper and IS scissor. These revolutionary articulating instruments are similar in design to laparoscopic hand instruments, but are flexible enough to navigate through the many curves and flexures of the colon. In the treatment of complex polyps, the DiLumen C2 is positioned and the balloons are inflated to create a stable therapeutic zone. Standard submucosal injection is employed to lift the polyp. DiLumen instruments are then used to facilitate a controlled manipulation and dissection of mucosal and submucosal tissue. The first of these devices, DiLumen IG, provides dynamic tissue tension as it can grasp and regrasp tissue and retract in multiple directions, which provides improved exposure for controlled dissection. The DiLumen IS can be used for both mechanical cold cutting and monopolar dissection. These new tools, along with standard endotherapy devices delivered through the endoscope's working channel, may reduce the learning curve for complicated endolumenal procedures and offer greater possibilities to treat diseases of the colon in a more controlled and precise way. Lumendi is proud to lead the way in developing the devices that will result in shorter procedures, faster recovery times, and lower costs to the healthcare system.